In this video, I'm going to show you how to test for CMC joint irritation or arthritis, that joint at the base of the thumb, how to test for that, and then what are some treatment options that you can do at home. So I'm first going to show you how to test to see if the CMC joint is irritated, inflamed. This could be from a synovitis, just where the joint capsule itself is inflamed. This can be due to osteoarthritis. There are several conditions that can cause this. So where is the CMC joint at? That's right at the base of the thumb here. So if you're looking at this model here, that's going to be right here at that portion on the base of the thumb. Now there are several tests for this that we're going to go through. Ideally this would be for a clinician or someone to be able to perform this on you. But if you're at home, you don't have someone that can do this technique on you, I'm going to show you how you can kind of do it to yourself. Now I do have videos on my channel that go over individual testing of this using a mock patient. But again, for the purpose of the video, I'm going to assume that you don't have someone to do that with, so I'm going to show you how to do this at home. The first test that we're going to do is called the adduction test. And so what you're going to do is you're going to take your hand in a neutral position here. The hand and wrist is a neutral position. You're going to bring the thumb down. So now my thumb is down kind of even with my index, or down as far as I can go. You're going to take your other hand, you're going to grab just below this knobby portion here, and you're going to grab a hold here and push down. You're going to push the entire thumb down. So what I'm trying to do is push my thumb down like that. So we're going to take a hold here, push that down into what's called adduction of the thumb there, and if that reproduces pain or symptoms, then that test would be positive. Next, we're going to look at the traction shift subluxation test. So what this is you're going to take your wrist and hand as a neutral position. You're going to take your other hand, you're going to grab a hold here of the thumb just past this kind of knobby portion here, also known as the MP joint. You're going to grab a hold here, and I am pulling. So I'm pulling straight away like I'm trying to pull my thumb off. Don't pull super hard, but a little bit of traction there. And then while I'm doing that, I'm going to bend my thumb kind of up and down. So if you can see, I'm taking that, I'm pushing down, and I'm pulling back. So what I'm doing is I'm pushing down here, and then I'm pulling back. And so while I'm maintaining that traction force, and I'm trying to see if that feels like that's going to kind of come out of socket, or if it reproduces pain, and if it does, that test would be positive. So this is going to be the pressure shear test. So what you're going to do is place the wrist and hand in this position, also known as neutral. You're going to take your other hand, come in here just below this kind of a bony portion that sticks out here, this joint, and I'm pushing in. So at the same time that I'm pushing in, I'm going to shear side to side. So if you can kind of see, so I'm going this way across and then back across this way. So I'm going to shear side to side at this joint here where the CMC is articulating with that carpal bone in our wrist, and see if that reproduces pain or symptoms. If it does, then that test would be positive. This is the CMC grind test. So what you're going to do is you're going to take your wrist, neutral position, you're going to come in, grab a hold of the thumb, and you're going to push in. So an inward force, you're compressing this joint down through here. So I'm pushing in, and then what I'm going to do is rotate. I'm just going to kind of twist from side to side my thumb while I'm applying that pressure, and if that reproduces pain or joint crepitus, then that test would be positive. So now that we went over the tests that you can do to try to determine if the CMC joint, the joint here at the base of the thumb, is inflamed for whatever reason, now we're going to go through some different pain control techniques that you can do at home. One of the things I like to use or have my patients use is one of these home TENS units. Now, of course, you want to make sure that you're safe to use this. It's okay with your doctor. You don't have certain implanted electrical devices like pacemakers and defibrillators. But I do like these. They're pretty inexpensive, simple to use. You're going to take the box, and then these leads are going to have these little electrode pads that go on here, and you're able to place those around the thumb. And those do good for giving some temporary relief. Just at times when everything's just throbbing and aching, unrelenting, you can't get it to calm down, you can put that TENS unit on, and that a lot of times does help with some of your symptoms. Using gentle traction typically will give a little bit of relief for a painful joint. Now we don't want to go with too much traction, because remember, one of the tests that we perform to try to see if this joint is inflamed is traction applied with some movement. So just gentle traction. So what you're going to do is just grab a hold of the thumb here, and just pull slightly, just trying to pull my thumb out just a little bit. Sometimes you can do that and kind of get a little wiggle while you're pulling. So not really hard, just a light tension. And I'd repeat that just throughout the day, maybe 4 or 5 repetitions, just as needed. A lot of times patients will use paraffin wax. So if you've seen those small wax containers that you plug in that heats up the wax, those are really nice because you can dip your hand down in that, coat your hand with a warm wax, and you put your hand inside like a plastic bag and then one of those gloves. It just gives that moist heat that really goes all around the fingers, the joints. That does really well. They're pretty inexpensive, but again, as always with any techniques or products that we talk about, make sure it's okay with your doctor or your healthcare provider before you use them. I also recommend heating pads. You know, if you have a heating pad that's in good working condition, monitor for your skin. As always, you don't want to end up with a burn. You can use a heating pad in this area or a warm Epsom salt bath. Those do really well. A lot of patients like to do those. Again, that's something that's pretty inexpensive and fairly easy to do at home. Just make sure that you don't burn yourself. Now we're going to go through and perform some exercises. I caution you with these to be careful not to overstretch the thumb or over irritate the thumb. A lot of times if you use one of these hand strengthening devices, if you get really far out there with the thumb and pull it out, that's going to irritate the joint. So make sure that you have one that fits in your hand so you can kind of start like this versus having to really open your hand to do it. And so I do like to use these different hand strengthening grippers or exercisers. This is really nice. This one's adjustable. Most of them adjust. I'd start really light at first and then progress, as you can tolerate. If it's too painful and this is uncomfortable in the web space here of your thumb in this area, I've had patients even, hold these in a modified way. Maybe don't put it so far in the web space, put it farther out on the thumb, just different things. Just kind of have to play with it and see what you can tolerate because you want to make sure and try to build some additional grip strength up. Now we're going to perform finger extension strengthening. So I have one of these little extensor bands here. This does really well to work on finger extension. Now, if this is too strenuous, it's too much, back off, use a less difficult band, or you can even just do little partial reps. You don't have to open them up all the way. Just do little small reps like that to work on the areas that you can tolerate to not over irritate the thumb joint. We're going to use one of these exercise bands and I'm going to kind of form it in a loop. I'm going to take my thumb in there and I'm going to work on kind of pulling down. So what I'm doing is I'm pulling my thumb down just like that. And so I'm going to go down, kind of pull it across here, and then I can work on pulling my thumb in. So now I'm going to try to bring my thumb in towards my index finger and work on strengthening in that direction. And then I'm going to hold it on the other side and I'm going to pull my thumb out. So I'm working on pulling my thumb away from my hand. So that looks like that, pulling it away. Just like before, you want to be careful and not use too much resistance to over irritate this area too fast. This needs to be more of a marathon versus a sprint. Wrist strengthening is very important when you're dealing with dysfunction and irritation in the hand. So we're going to take a dumbbell, make sure you get a light dumbbell, and we're going to just kind of prop up here. I'm on this little pad, but you can use a towel roll or whatever you have at home. I'm going to work on wrist extension. So I'm just bringing this back. You're going to feel this up your forearm here. So I'm going to do wrist extension, and then I'm going to work on wrist flexion. And then I'm going to take the dumbbell. We're going to work on what's called radial deviation. So I'm going to hold the dumbbell at the bottom, but initially you may have to hold the dumbbell kind of in the center, but I'm going to hold it at the bottom. That makes it more difficult. And I'm going to pull back and forth like this. And that really works two of the muscles whose tendons run down the back side of the thumb here. I'm just going to do it like that. And with most of these exercises, I usually tell patients to work on maybe 2 to 3 sets of 10 to 15 repetitions. Now, as far as bracing, taping, or stability, there are some options that you can do. They do make a CMC brace that goes around the bottom of the thumb. It just kind of slips around and then fastens on. That does really well. They also make what's called a thumb spica, S-P-I-C-A, brace that you can slide on that just helps to stabilize the thumb and keeps it from moving around too much. So I have patients use that, especially during times when the thumb is really inflamed and really irritated. So you can do that. You can also take, this is a Coflex or a Co-Band. There's different brands. I'm going to take this, I'm going to cut a slit right in the center of this so that my thumb will fit through this. I like this technique. You can do this also with a small ace wrap, ace bandage if you have that. So I'm going to put my thumb through the hole there. And then what you're going to do is you're going to take the tape and just kind of wrap it around your wrist. And then you're going to come around the thumb. You just wrap that around, and basically you're going to create what's known as a thumb spica brace. Move my bracelet out of the way here. And so you're going to do that, just wrapping around, and that just gives some stability there. If you're going to be at work or doing different things throughout the day, be pretty active, that works really well at just giving that extra support to ensure that you don't overstretch your thumb joint. Then something that's very important is also any adaptive equipment if you have access to it. This is a little foam tubing here. If you notice the hole in the end of that, you can use these to put forks down in, spoons. If you had difficulty bringing your thumb in for grasping, just makes things a little bit bigger for you. You can even put a writing pen or a pencil in here to hold on to. It makes it a little easier so you don't have to stay in such a flexed position with the thumb. Now make sure that you don't use something that's too large. I've had patients before use those those big foam pieces that go around maybe a water faucet outside or something like that, and that gets really big. Just remember, we don't want to pull the thumb too far out or too far back because that's going to overstress this joint. So you can use anything that builds up the handle a little bit that makes things easier to hold on to. Also using a piece of like Dyson or the non-slip pads that you use, maybe that you're going to put to keep coasters or different things from sliding on a table. You can use those and use those to open jars and lids that are very difficult to open. But again, as always, just make sure you don't bring your thumb out too far. Try to keep it closer in. That's going to protect that joint a little bit better. Thanks so much for watching. I hope this video helps decrease your pain that you're having in your thumb, improve your strength and mobility, and overall improve the functional use of your hand. Thanks so much.